Everyone has a story, but not every story was told. Here in the Untold, we get the chance to meet a variety of individuals with a variety of fields. I am your host, Mazoug Said, joined by my dear colleague, Abdullah Hindiani. Welcome, Abdullah.
Thank you. Welcome for you as well. Yeah, for the Untold, we do have a lot of special guests. For today's episode in particular, we have Dr. Saba Anjum, who is a remarkable figure in the dentistry field. Yeah, and she's going to be educating us all about that.
Exactly, like how did she start and find her purpose in this? And I think she has a special story to share with us.
Yeah, I'm really curious to talk to her, especially because dentists, for a lot of people, are like, scary figures, right? When you're going to the hospital to check for the flu, you don't feel scared. But when your parents used to tell you, we're going to go to the dentist today, you're going to be like throwing fits and everything, going to be crying. And, she's going to be educating us about that and correcting all of those misconceptions.
Definitely. I cannot wait. And if you have a children who are really terrified from this going to a dentistry, then this episode is going to be different for them. Stay tuned until the end of the episode.
And welcome back from that break where we are joined by Dr. Saba Anjum, who's a renowned dentist in the field of dentistry, and she's going to be educating all about her field.
Yes.
Yeah.
Hi, I'm Dr. Saba Anjum. I'm
Welcome
a
to the show.
prosthodontist. Yes, it's a pleasure to be here. I'm Dr. Saba Anjum. I'm a prosthodontist and implantologist.
No, I was just going to highlight those two keywords because I kind of had trouble making sense of them.
Prosthodontist.
So would you like
Yes.
to educate us
Yes. Prosthodontist. This is, even you can call it as oral maxillofacial surgeon. So we deal with the head and neck part. So this prosthodontist is related to missing teeth, missing facial structure like eye, ear. This all we deal with is a prosthetic surgeon, you can call. Okay, so I deal with especially missing teeth as well, like crown, bridges,
Yeah.
okay, and implants for the missing teeth, and removable or fixed dentures. So this is my profession deals with this specialty.
Very nice. And talk about like missing teeth. I remember when I was a kid, whenever I hear like going to a dentist, I usually find some obstacles or like I get some terror.
Yeah.
If it's like if your parents want to punish you, they take you to a dentist. So for you, was it like the same case, like going to a dentistry when you were young?
No, actually, I was not aware of dentistry so much. Back those days, my parents were also like not so much regarding concern about my dental issues and all.
Yeah.
But Alhamdulillah, I was not having any dental issues much.
You brush every day?
Yes, I brush every day.
Like
So-
you, yeah.
And my dad loves my smile, so it's fine, Alhamdulillah. So I was not scared, but these days now kids and all the things have been so much advanced. Kids don't get scared; they feel happy to come.
Yeah.
We make them feel comfortable. We make them know what we are doing to them. Okay, like we show them how we do, what we do. They feel comfortable, and the environment also we create such a way the kids, they like to be having the funny cartoons
exactly.
and all. The clinic will also be like that way, so they feel
Calm
comfortable
them
now.
down.
Yes, they calm down.
Instead of surprising them all the
Yes,
time.
yes,
Because clinics nowadays are so colorful.
yes,
Like
yes.
I remember when we were kids and I used to have teeth problems, my parents would, wrap the thread around my teeth and then put it on the door. And then they would
pull
close it, and that's how they pull the teeth.
Yeah,
So
now
my
that's-
whole idea about dentists was like a nightmare. But actually, it's so, it's so lively.
Yeah.
They're so friendly. They're so welcoming.
Yes,
Yeah.
definitely. These days we make them relax on the chair. The
Yeah.
chair will be like a toy, okay, colorful, and they can watch the TV. And it feels now it's like anesthesia. What we give local anesthesia. That is also they feel very comfortable. It is like not painful.
Yeah.
So they feel comfortable and they get it done and they feel happy and they come back again. They go again and for the checkup. Happily, kids come back.
That's really
Yes,
good to
now-
hear. And
yes.
for parents and also for kids now, they have a calm down. It's easy for them.
Yes. And I especially deal with middle-aged and adults.
That's really cool.
Yes.
Yeah, but speaking about kids in particular, I want to go to your childhood. What made you choose dentistry of all fields? Like, how did that decision come along?
It's a small story. So it's like I was very close to my grandmother. Since when I was small, I used to accompany her for her dental visits, and I have seen the change. Like a small smile of her. Okay, once she got her teeth done, the way things have changed. She was very comfortable and confident in her smile for the photos especially, and she used to have a very soft diet because of no teeth, proper teeth. Okay, it was like that. So once she got her teeth, then she's having good food, whatever she's eating she's enjoying, and this had affected this oral health, which is very important. Okay, this had affected her complete health as well, physical.
And his
So she eats,
atmosphere and
yes, attitude and overall the health of my grandmother, like overall health. If you have a good oral health, you can eat and chew nice food.
Exactly.
This will definitely affect the overall health, and
You can
she
enjoy
was
the different
confident.
taste,
Yes,
different
different
variety
taste.
of food dishes.
Yes, this had this had not only made me feel like something like teeth or something. It's like it had made
It's
me feel
life-changing.
emotional. Yeah, emotional as well. I feel like it is a combination of creativity and care.
Yeah.
She was very happy with the dentist as well. So this had touched me, so made me feel okay. This small change makes some person feel so good and confident. So I felt, this is my
That's really
call.
awesome and inspirational
Yes,
story that you
yes.
already shared. I know that kind of inspired you, but
Yes.
when did you know like this is your calling maybe, or something you really want to pursue so hard?
There is it's like when somebody smiles, and this makes a huge difference. I didn't know. I was fascinated about how small things a smile could change.
It's a big confidence boost.
Yeah, a smile can change a person's confidence level. Okay, I have seen even the young patients during my training period of my dentistry before my specialization. Young kids, or they're young kids, they just met with an accident or fall off anterior teeth, front teeth, they break it and come. Once they get done, they feel so good. So this smile thing, I want to give a smile to everyone. Like it is a, like how I said, combination of a creativity and care. I want to give that care. Okay, and I want to give that smile to everyone.
And it's
So
such a
that's made me feel.
and it
yes.
makes such a huge difference, because I remember one of my friends who was studying dentistry, he used to have these books and PDF files, and then they had patients before and after when they got their smiles fixed. And you can actually see how much happy they have in
Yes.
the after photos.
Yes.
Like before, their eyes are all, they're sad or something.
Yes, kids, they have this caries in the anterior teeth, especially the discoloration. Once they get it done, they feel so good. They feel confident for
And
the
it's so,
photos.
it's so
for the-
noticeable on them. Yeah, you can
Yes,
see
yes.
them actually happy.
Yes, very happy. And, it will improve everything, self-confidence and eating habit
Attitude,
and everything.
a lot of things.
Yes.
And like there's of course Abdullah, a lot of fields in dentistry. What made you like kind of choose prosthodontics?
Prosthodontic specialty, yes. I'll tell you this. Actually, it's like when I was doing my UG, like undergraduation, then I was like, I feel like this is specialty. It's a challenging profession where you have to plan, execute and deliver it very beautifully. It's a planning thing.
It's not
You
like
have
something
to-
simple. You just
No,
one-time
yeah,
process.
exactly. This specialty is especially you have to plan it. You have to go according to the patient, every individual patient, and you have to be precise, because it's not just dealing with the oral cavity. It's you're dealing with the complete. If just a strand of a hair makes a huge difference, something
Strand
in your
of a
mouth.
hair?
Yes.
Wow.
It makes a huge difference, right? If you have something in the mouth,
Yes,
that
definitely.
difference you can make out. So when we are replacing the whole complete teeth, something like in your mouth, so you will feel the difference. I should make sure that you should not feel that difference. You should be comfortable with what we do.
Yeah.
So we have to be precise with whatever design I give, whatever I'm planning according to the patient, customized. So we have to plan it, design it, and it is so challenging, and it is so exciting for me to do for every patient. I feel so happy, and the outcome, once the patient is happy, it makes me more happier.
Proud,
It makes
yes.
my day. I can just go to bed and sleep peacefully.
Feeling achievement.
Yeah, it feels good.
It's like you're artist. You're
Yes,
painting.
it's
and
a combination of
and your
science and
artwork.
art.
Yeah.
Yes, science and art. We have to have this. This is it.
And I want to go specifically for the field itself, because I know that studying it is challenging and staying with it, and it takes a long time.
Yes.
So I want to say, through those obstacles, through those times, who were your biggest supporters? Who always stood by you? And what kind of impact did that have on you?
Yes, I would say Alhamdulillah first during my journey of educational journey and all. My parents, the greatest support for me, their silent prayers, their love and their
Yeah.
support. They doesn't belong to this background of healthcare, but still they know the value of a dentist or doctor healthcare. They love for what I do, so they're happy. They supported me in every thick and thin, and during all my career education, and alhamdulillah after then I have my wonderful amazing husband who supports me.
He's right
Shout
there.
out to him.
Yes,
We're gonna
yes.
say hello, husband. Yeah.
Yes, he supports me, and I'm so glad that we share the same profession as well. So we are go-to couple, I feel, alhamdulillah. So this is how the support from both the sides I'm getting from my parents. Then this legacy is continued from like my husband as well.
That's
So,
really cool. Shout
yes.
out to the amazing parents and shout out to the husband as well.
I have a little kid. So whenever I see him, I feel good. And this is also like for him, I need to be a super mom. I need to
really
do
awesome.
more for him. So this keeps me going.
And I know like
Yes,
sometimes
the
like
fam-
impact can have like really a positive impact on you as well.
Yes,
So
yes.
during your student time as a student, what were some cases where you felt like really positive impact?
Yes, I'll tell you. Thing is, during my student life, it was being thought like you have to listen. So this is the patience level, first thing. This had deeply shaped me, especially for the listening. You have to listen what patient says, how they feel, their emotional, and what they're expecting from us, what they exactly need from us. How is it? We have to know them every way. So once we know them, then it is for us comfortable and easy to design or the diagnosis and the treatment plan accordingly. So this is like I am even now. I don't feel bad with sharing with, like, if I feel something I need to discuss or anything, I feel comfortable, and I make sure the first visit itself, the patient, I will just not rush to do some treatment. Okay, missing, come on, let me replace. No, I make sure I listen what they need, how they want it to be done, big, small, or they are scared of dental treatment. Some emotionally, like, people will be scared, not only kids, like we were previously
Even the
talking about.
adults.
Yeah, adults, I have my patients, they are very scared. So they come, I make them calm down. I make sure I discuss with them all the treatment and all the process, how we go about, and it is not just what we do, it's like how we make them feel a long way during the whole process and the treatment. So this goes for a long way.
So the human aspect is something that you really appreciate about this kind of work.
Yes.
Communication and emotional
Communication,
stability.
yes, this is very
Very
important.
important before
Yes,
taking
yes.
the.
This is what I have keep going. You have to listen peacefully, I reassure with, and empathy. All this is very important with the
Take
patient.
into consideration.
Yeah, to take all this
To
into
make the
consideration.
procedure even like better.
Yes,
and
better, and
successful rate high.
Yes, and appreciate for every small improvement what we are doing during the procedure. Like maybe I have to extract the teeth. If it is too much bad condition, then I'll explain them. I extract. Then when I put the temporary, I make sure they will feel good. I'll explain, and they do feel good when you remove teeth and immediately put some temporary. They feel good. That's I celebrate. I like feel good and make them realize this is the improvement. It's fine. So
Exactly. That's
yes,
the
that
first phase
satisfaction.
when you are dealing with a patient, and of
Yes.
course there's a lot more behind the clinic doors. And we're gonna take a break, then we're gonna come and discover what's behind the clinic doors. So stay tuned.
And we're back with Dr. Saba Anjum, and I want to ask you a question about the misunderstood facts or things about your field. You know, a lot of people have so many ideas about dentistry, but a lot of them are misunderstood.
Yes, prosthodontics. Okay. Here, people think like it is painful, the dental procedure, implants especially. Okay, surgical procedure is painful, and
Takes
it's
time.
just, yeah, it takes long time, and it's just, aesthetics and all. No, actually, it is pain free. Once you plan it, I was just telling you, it is a planned procedure. When we are planned and precise, they'll be like, now they are so much advanced. It's techniques when we are doing the surgery, no pain, less pain completely. It's like and no blood loss. Okay, there is very less punch technique, something we call no blood at all. We
What is
just
that?
place it when we do the surgery. When we place implant, bleeding, when we have to give a incision cut to place an implant.
Is that
Okay,
punch technique?
no, this is a surgical incision
Oh, okay,
technique.
okay.
So I'm telling, if you surgically, if you open it incision,
Yeah.
the blood flow is little more. It doesn't matter.
Yeah, they
Okay.
think like it's a flood of
Yes,
blood and
yeah, little,
looking
yeah.
messy and
Yes, no, now it is not at all. It's like very easy, very comfortable, and it's like no blood, no pain. It's comfortable
that's
procedures.
really awesome.
Yeah.
And I know some of them who are watching us still hesitant.
Yes.
However, was there like some emotional, like maybe severe emotional case that came to you and how you were able to handle it?
Yeah, I had got a case like that, middle-aged woman. Okay, I will be dealing such cases where initially they are very much emotional and very scared as well about the procedure. Once we start like painless and we go accordingly, then they feel comfortable. And I, especially as I was telling, I will listen to them what they want, and if they are afraid or if they want me to stop at any point, I'll make
will stop.
sure. Yeah, I will stop it. I will just make them calm, then I will continue.
Yeah.
You just like, okay, come on, come on, Ella. No, let's make them calm and then make them feel good. Okay, if you feel comfortable, we'll go ahead. Like that.
It's not about like rushing and taking the other
No,
patient,
yeah.
rushing and taking.
Yes, no rushing.
That's really awesome.
Let's go calm, and they feel good, comfortable doing all this procedure. And now it's like very much advanced. We have something like, guided surgery. You don't even feel like you got your surgery done. It's like maybe some 30 to 40 minutes full mouth. We have especially challenging cases like to replace complete mouth, okay, complete
Yeah,
teeth,
back of
upper
teeth.
and yeah, that surgery takes time, but patient is so comfortable. Once we start the procedure and finish, they don't feel
Feel the
anything.
They're just
Yes,
laying there.
yes.
Yeah.
Now that's what the advancements are so much
That's
that
really
the
awesome.
dentistry is not at all painful. Okay, it's
Yeah.
nothing like you have huge blood loss, or you feel that. No, it's so good, and it is like you can be. The most important thing here, like, you have to be planned and precise. That will go super cool and super easy.
Such a
And
relief.
yeah,
Yeah.
it relief. We don't feel much pain as well.
So-
Completely.
So with working with so many patients, what would you say is something that most patients are afraid of going to the dentist? Is it the operation? Is it the pain? Like with talking to
They're afraid of the pain.
Okay.
Pain, right? Especially
Yeah.
many of my patients, they don't want. Nobody wants pain. That's
But
a
it's
basic.
so many operations nowadays are painless. Right?
Yeah, that's what they were afraid. When even me myself, when I just sit on the dental chair, I'll be scared. I may have pain, but I will not. I know it, right?
Yeah.
So the same thing. Once you come for the dental visit, once you feel that there is no pain during the procedure, they feel comfortable. Now they are not scared of, and maybe they are just have this in mind. Placebo, something like, I may have this, I may have that. No.
Yeah.
We have to, this is my job, to make them feel comfortable, make them understand exactly.
So what drives your hunger? Because I know for a lot of doctors, they as soon as they get employed, they think that's it. I'm gonna just work with patients. But you, mashallah, you went
Yes.
further and beyond.
Yes.
So what was the motivation behind that, and what keeps you driving?
Yes. For me, I feel like as much as I'm just moving forward, the world is ahead now. Everything is like advanced, and everything, moving. You have to be ahead. We have to reach
yes.
everything new, updates, whatever we are getting. With every fellowship or mastership, whatever I learned and I enhance my skills,
Yeah.
I want to give my patients the best treatment. I want to be updated. I want to make sure I give them more and more comfort. And every of this, my achievements of fellowship or mastership, I have learned a lot. I have, I have my betterment, I can see myself, better planning for the patient, their treatment, I have improved. This improvement, I love it. And I want to give this care of treatment to the patient. So this, I want to always keep learning. This is, I love to be improved.
That's really awesome. And also, like the students who are watching us and you all want to pursue the same career, then continuous learning is important because it's gonna keep you on the top of the game, especially if you are like right now, we are like moving rapid fast.
Yes, AI is there in everything all around, and advanced so many things, robotics, and everything is like advanced. We have to go along and
Keep up.
yes, keep up. It feels good. It's good to know new things.
Yeah.
If you
Right.
went back like in the times,
Yes.
what's one thing you could tell your younger self?
Oh, yes, I will tell firstly, it's like you need to trust your instinct. You need to trust yourself. Okay, even if you're unsure about it, you should always be, ready to go ahead. Even if you feel like something, don't just stop. Just push yourself.
And have faith in
yes,
yourself.
and faith, and you have to be
Yes,
for,
'cause in you-
and never get afraid of asking questions. Okay, even if you are in a situation where you should be knowing the answers. Example, me, if I am in situation where I feel like the case is complicated or whatever, I feel like something I am missing. If I feel that sense, I am not afraid, and I will make sure I discuss with my colleagues. Okay, my friends.
Discuss with your colleagues.
It's a learning phase. The life is a learning phase where we learn from each other, share knowledge, then it grows. So we should never feel ashamed of learning. If you don't
And admitting
learn,
that you don't know the answer.
yeah. No, it's no problem. If you don't know the answer, we'll find out.
Exactly.
That's it. I'll find out. It's not like I don't know the answer, or it's not like, I should be knowing it. I am now a specialist. I should be knowing it. No, I don't do that. I make sure I discuss with my friends, colleagues, wherever, whichever point I feel like, yes, I think I need to take an opinion. Feel free to take. This is how it's life.
Yeah.
We need to learn, keep going, and everyone is different, right? Everyone
Definitely.
have their opinion. Maybe that had helped me during my treatment plan. We discuss that point. I would have missed out. I should not think about I am the perfect. No,
Yeah.
we should always keep learning.
Love it.
Yeah, I
Yes.
think a lot
Beautifully
of
said.
students. Oh, I was just going to say that a lot of students are afraid of asking the wrong questions, that they completely stay quiet, and that's the wrong behavior. Because
Yes.
Any kind of question you have, you got to ask it. Have that
Yes, feel
curiosity.
comfortable to ask. You will grow when you do mistakes. That's the best teacher, right? Mistakes teach us a lot. When we do mistakes, we will know what is right. If you keep on doing right, you never know what is wrong.
You'll
So you
get
should do
experience.
wrong. You should learn from it. You
Yeah.
should ask stupid questions, everything. Then only we'll know what is right.
Because they're gonna give you the experience.
Yes,
And
experience.
talking about
Failure is-
experiences, yes. What is like after mashallah getting all these experiences, what is the next thing that you're looking forward to?
Inshallah, I am on it. So I have even written a chapter in a book of
A
AI.
book?
Yes, yes, I have a
Mashallah.
chapter in a book of AI in prosthodontics. So Alhamdulillah for that. And I want to, it should not be like just a clinic. I want to have it. No, I would like to have a combination of a place where we restore the smiles. We see happy smiles, and we see some confidence and the sharing knowledge. That this place in one single roof, under one roof, all this. I want the combination of all this, not just a clinic, where the people come and have a happy smile and, professionals.
happy.
Yeah.
I would like to share my knowledge, and whoever comes, they should be confident in doing the cases, and they should be sharing the knowledge. All this under one roof. So it is like I would like to have the legacy, not like what I am. It's like what I do.
Yeah.
So I want to have that legacy in my life, inshallah.
Inshallah,
What I
inshallah, very
do,
soon.
it should be a long way. This is what I have done.
Definitely.
Like that. It's
And
not
actually,
like, who am I?
when you were talking and sharing your inspiration and your legacy and all the motivation, we couldn't take our smiles back,
Yeah.
We were keeping our smile because it's really amazing to see someone who have a purpose and are practicing his passion on day-to-day basis.
Yes. Thank you.
And we're kind of running low on time, but I do want to ask one last question because you mentioned, I think twice in this interview, the influences or the integration of AI in dentistry.
Yes.
What are your thoughts? Let's just wrap this episode about your thoughts on AI in your field. Are you for? Are you against? What?
No, I am with it. I'm
Yeah.
not against or anything. I am with it. I want to, this AI is booming now everywhere,
It
in
is,
every
true.
field. It's not only one single thing. Even in a restaurant, a robot is coming. So even in surgeries, the robotics is there. Even now, advancements have so much advanced. You can see the treatment before we do it.
Yeah.
Example, yeah. If you have to make you a smile, we just scan it. We have a exocad, exoplan, all these things software. We just show them how is the outcome as well. Before we do the treatment, you have the outcome showing to the patient. This is how your treatment going to be. So yeah, I love to be a part of this AI, and I am looking forward for the more advancements and to be along in this journey.
So since you mentioned like you're gonna write like a book regarding like AI and this dentistry, and that's something coming up. So after 50 years, what's something you have in mind?
Yes, first let me tell about the book. So I'm on it, working on a project. Inshallah, it will be soon coming. And yes, I have written a chapter on AI in prosthodontics. So I'm looking forward for the more books from my side. I love to write, and I have my publications as well, what I have done. So my articles. So I am combining it, everything, my knowledge, and making a book. Inshallah, that will be coming soon. So as you said, about 50 years, so I don't want to wait so long. So maybe in just 5 years or something, I want to see myself in someday in a very, very good position. Like how I was telling, I don't want to be who am I. Like it's like what I do should matter. So after 5 years, yes, I would like to have a wonderful, not only just clinic, space area where we have multiple opportunities for the students of my profession, which I can make them feel confident in doing work, make them feel good, and they should share their knowledge as well, and beautiful smiles I would like to give to everyone. So this is my major goal.
Yeah.
Beautiful smiles.
Yes, beautiful smiles always. It should be like Saba, then okay, this smile.
The smile doctor.
Yes.
Yeah. And I think, unfortunately, because we've run out of time, the thing that I want to highlight from this interview is the importance of having a supportive circle and having the motivation and the drive. And mashallah, we've seen that from you. We've taken that from you. So I want to thank you for joining us today, Dr. Saba Anjum,
Thank
for
you.
this lovely interview.
Thank you.
But unfortunately, that was all the time we had for this episode.
Definitely. Thank you so much.
I
And keep
feel
smiling.
Yes. Thank you. Thank you.
And unfortunately, we've reached the end of the Untold with our interview with Dr. Saba Anjum for today. She was very remarkable. She was educational. She highlighted the importance of having support, the motivation. Like, mashallah, she excels in her field. She's writing a book. She has visions for the future. It was very entertaining talking to her.
Exactly. With a great milestone, she mentioned that in order to become successful, you need consistency.
Yeah.
Because that's what's gonna lead you to climb the highest mountain peak.
Yeah. Basically, the gist of this episode is what you're going to take from this whole episode is that have the proper support, have the discipline, and the motivation behind it.
With these three ingredients, you're gonna turn any obstacle into a miracle. Until next time, work, take this advice, and make great things happen. See you later.